Right, hi there everyone, and welcome to our lumbar spine assessment. This is my patient Ishvan. So it's obviously the first step is to take a good history. It's important to ask about the location of pain and the symptoms of possible nerve root impingement, pins and needles, tingling, numbness, and probably the most important thing is to look at any red flags. Excuse me, any bowel or bladder dysfunction or saddle anesthesia could mean potential cauda-equina syndrome, which is obviously a medical emergency. So that's probably the most important thing in terms of the history. I'm just going to, as we move on to the assessment now, I'm just going to check posture first. Ishvan, if you can just stand up over here for me and just facing the green wall. Sorry, okay. That's right. So yeah, just looking from the posterior aspect, obviously looking at any bony landmarks. So I'm just looking at the iliac crest there for any pelvic tilt. And the posterior superior iliac spine as well, that's quite a good marker. Looking for any obvious pelvic tilt there. And I find it's good just to run your hand down. This gives you quite a good indication of the lumbar lordosis as well. And then you can palpate the paravertebral muscles for any muscle spasm, which you could potentially see a reduction of the lumbar lordosis. So just run the hand down there, and that seems fine. Great. You can just turn to your right for me, Ishvan.
Yep.
Perfect. And from this aspect, we're looking at the pelvic tilt. So if there's any anterior pelvic tilt or posterior pelvic tilt, and again, it's good to see the lumbar lordosis here. So just running hand down, looking for any obvious abnormalities there. And again, the thoracic kyphosis and the cervical lordosis. There's a little bit of forward head posture there, but otherwise it looks fine. That's great, Ishvan. Okay, you can just turn and face the green wall again for me.
Okay.
So I'm just going to ask you to bend to the left as far as comfortable. Great. Any pain there?
No.
And to the right for me. That's great. Any pain there?
No, nothing.
Excellent. Come back to the middle. So when you're looking at lateral flexion, it's important if the patient is bending to the left and there's pain on the right-hand side, it could indicate a disc herniation, which is causing impingement of the nerves on the right-hand side. Also, obviously, it can compress the facet joints as well. Can you just lean the upper body back for me as far as comfortable? That's fine. And come back up to a standing position. Any pain there, Ishvan?
No, it's fine.
So the extension was fine. And again, obviously that's a closed pack position for the lumbar facet joints. So it's important to assess that movement there. And just going to, if you can keep your feet still, just going to rotate your trunk to the left. Any pain there? To the right. That's great. And back to the middle. Perfect. Just going to move this bench slightly forward. That's great. Ishvan, you can just try and bend forward as far as you can. That's fine. And obviously flexion is important now as well to look at the alignment and any mild scoliosis. So the alignment is fine in that position. And again, if there's pain in this movement, it could be due to disc herniation or sacroiliac joints as well. Great stuff. So right, so that's range of motion. Just come take a seat for me over here, Ishvan. So I'm just going to take the camera, just place it over here to get a bit of a better view of the assessment. That's great. So we can see the feet there. Okay. So obviously the first thing is reflexes. So I'm going to do the patellar reflex. That's L4. And that's fine. So we're testing the patellar reflex L4. And the ankle reflex S1. So those reflexes seem fine. Test the same on this side. So that's S1. Great. And we can move on to sensation. Ishvan, if you can just close your eyes for me. So I'm going to do some light touch. Just say yes when you feel it on both sides. So L3.
Yes.
L4,
Yeah.
L5,
Yes.
and S1.
Yes.
That's great. So your sensation's fine there. Excellent stuff. And obviously looking at the myotomes. So just to break it down, we start with hip flexion. That's L1, L2. Ishvan, if you can just push your thigh up against my hand. That's great. You can relax. And this side. So hip flexion L1, L2. And knee extension. I just want you to push your leg forward against my hand. Knee extension, that's L3. And this side for me. That's great. And I'm just going to ask you, so that's L3. So ankle dorsiflexion, just push your foot up against my hand. Great, that's L4, the same on this side.
Sorry.
There we go. And again, perfect. That's L4. And then great toe extension, just push your big toe, just your big toe up against my finger. That's great. And this side. Excellent, that's L5. And S1, or which is plantar flexion. Push your foot down against my hand.
Like that.
That's great. And this side. Perfect. Excellent. Okay, so from a neurological point of view, that's 100%. Okay, so the dermatomes, myotomes, excuse me, and the reflexes are fine. Ishvan, if you can just lie onto your back for me,
Okay.
with your head over here.
Okay.
That's great. Okay, so move on to the supine part of the examination. So I'm going to start with a straight leg raise test. So if there is pain in a limb, then you start on the normal limb. So I'm going to raise the leg, keeping it straight, and the hips slightly adducted to about 70 degrees.
Yeah.
Any pain there?
Only in the hamstring because I'm not too flexible.
That's fine. Okay, so a bit of hamstring tension there.
Yeah.
That's about 70 degrees there. But no pain in the back or radiating down the leg. Okay. Great. And just as an add-on to that, we've got the Braggard's test. So we back off slightly if there was any pain, and then we dorsiflex the foot. Okay, which can confirm any nerve root impingement there. Okay, but that seems fine in Ishvan's case. But we go up to about 70 degrees, and any pain in the back or
Nothing.
or the leg could indicate lumbar lumbar nerve root entrapment. If you have leg pain only, it may mean that the disc herniation is slightly more lateral. If you have back pain only, it could mean that it's more central herniation. That's great. Then we move on to the bilateral straight leg raise. I'm just going to raise both legs. And again, go up to about 70 degrees and slightly beyond. Any pain there?
Only the hamstring is pulling, but
Okay.
mostly on the right side.
That's fine. You all right?
Yeah, yeah.
Great. So as we come down, and we do the bilateral straight leg raising test. So we're looking, any pain before 70 degrees could be indicative of the SI joint, excuse me, involvement of the SI joint. Any pain after 70 degrees could mean the lumbar spine. As part of the supine assessment as well, we could do the Patrick's test. So the leg in this position, we're just going to push down on the opposite knee, and a positive test is if the knee remains above the other knee or if there's any pain in the back. So looking for iliopsoas spasm or any sacroiliac joint dysfunction with the Patrick's test, and obviously do the same on the other side. That's great. Ishvan, if you can lie on your tummy for me.
Of course. Yeah.
That's great. So,
Good.
thank you. That's perfect.
So good.
So, I'm just going to turn the camera slightly. So, in the prone examination, the first test we're going to do is the SI joint compression. We're just going to compress the SI joint on the left-hand side. Any pain, Ishvan?
A little bit, yes.
Okay, a little bit there, and this side?
Yeah.
Okay, so there's a little bit of pain there on the SI joint compression. And also move to the facet joints, just move down the spine and apply a PDA pressure over the facet joints, looking for any tenderness or any facet joint inflammation and involvement there. That seems fine. So a little bit of sacroiliac joint dysfunction there, a little bit of a block there. Okay, and I'm just going to do spinous percussion. It's important to look for any possible signs of fracture. I'm just going to tap down the spine with my reflex hand mesh one. Just tell me if you get any sharp shooting pain or anything unusual. Is that okay?
Yeah, it's fine.
Great stuff. So that's spinous percussion. And again, just in terms of, we could also do spinous pressure, just with our thumb, just looking for any areas of tenderness. Down the lumbar spine.
Mm-hmm.
Great stuff. Thanks, Ashwan. I appreciate that.
No problem.